Well, let's get you an update on the swine flu in India. And so far, there have been 5 cases, all of them coming forward on their own. But flu experts say the numbers may not be so significant, but the new H1N1 virus has now established itself in the country. And they also went on to mention that once the climate changes, the chances are the virus will emerge in the local population and spread quickly.
Patients infected with the H1N1 flu are being kept isolated behind these walls, but the virus can't be locked in. It now seems to have a permanent home in India. So far, those infected are people who travel to pandemic sites like the USA. But epidemiologists say these cases, though cured, have brought the virus to the country. And indigenous cases are expected to come up once summer ends. And when they do, they will be harder to trace because the cases will surface within communities and spread rapidly. At least 30 million people in this country are migrants and can spread the virus.
Currently, because we are in the middle of summer, the virus probably will not be that active in terms of spreading to other people, and this is what the surveillance of influenza in our country has shown, that it tends to be very less during the summer months, picks up during monsoon and in the winter months. We have 3 viruses circulating in our country. H5N1, which is circulating currently among the birds, poultry. Then we have seasonal flu, and the third virus, which has now come in as a new virus, is the H1N.
Screening and testing facilities are in place, but they will not be of any use once the virus appears within the community. The only way to control a pandemic is through surveillance.
We have told all the state surveillance officer and the district surveillance officer to report us any clusters in case they see any cluster in any part of the country. And since this project is in different part of the country up to the periphery, so we are hopeful that through this system we will be getting the information.
The flu season starts in October. What is worrying virologists is the possibility of the new virus mutating into a more virulent strain, and if that happens, the pandemic will be hard to control. With Maua Chaudhary in New Delhi, Ambika Verma, NDTV.